and thank you for joining us. This briefing is being aired live on YouTube. A reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. Joining us for today's media briefing are Stephanie Smiley, the Interim State Health Officer and Administrator of the DHS Division of Public Health, and Dr. Ryan Westergaard, the Chief Medical Officer with the DHS Bureau of Communicable Diseases. And we'll begin the briefing with remarks from Stephanie Smiley.
Good afternoon, and thank you for joining us today. So I want to start with an update on our daily numbers. There are now 39,627 total confirmed cases of COVID-19, which is an increase of 900. Unfortunately, we're reporting 4 more deaths in our state today, for a total of 831 people passing away from this virus. These numbers from today, from the past week, and even further back, tell us that Wisconsin is seeing significant community spread. And we know from contact tracing that the percentage among 20 to 29-year-olds attending a gathering, party, or meeting with people outside of their household was 30% during June. And that's compared to 7% during April and 12% during May. We get a lot of questions from folks wondering about protests and how those contribute, to the spread. And I'll add that, as a result of our contact tracing, we're barely 1% of the people who reported attending a gathering reported attending a protest, rally, or other demonstration. But a gathering doesn't have to be one of those types of situations, or even very large, to be dangerous. We know that meeting up with friends for drinks or going to a birthday party, these types of activities definitely do spread COVID-19. We want you to remember that COVID-19 is very much circulating in Wisconsin, and we're encouraging you to take every step that you can to stop the virus. If you can stay home, please do so. Limit your trips to the essentials, practice physical distancing, and wear a mask if you can safely do so. Wash your hands, and also get tested if you have symptoms or if you've been exposed. We all have a part to play during this pandemic, and we want to make sure that the part that you're playing also helps stop the spread. And now I'll turn it over to Dr. Westergaard.
Thank you, and good afternoon. I'm Dr. Ryan Westergaard. I'm the Chief Medical Officer for Communicable Diseases here with DHS. Today, we want to bring you some more information about multi-system inflammatory children in children, or MISC, which we've discussed previously on briefings and has been in the news. MISC is a rare but serious condition where different parts of the body can become inflamed. It could include inflammation of the heart, lungs, kidney, brain, skin, eyes, or gastrointestinal organs. It's not known exactly what causes MISC, but it appears to be triggered by COVID-19 infection, and it's possibly related to an abnormal reaction of the immune system to the virus. Since this condition was first described, we at DHS have been working with CDC and with medical providers in Wisconsin to determine whether there have been any cases in Wisconsin children. And as of this week, we have had 6 confirmed cases among Wisconsin residents. MIC can be difficult to diagnose. It requires a clinical examination and multiple laboratory tests. When someone is diagnosed with MISC, they must be hospitalized in order to get proper medical care. Some may have to be admitted to intensive care units. In our state, 4 of the 6 children are under age 10, and 2 are between the ages of 10 and 15. While all the children were hospitalized when they were first diagnosed, 2 remain hospitalized at this time. The others have since returned home after their conditions improved. Wisconsin Department of Health Services continues to monitor the situation as we look out for this uncommon yet serious condition in our children. Multi-system inflammatory syndrome is one of the ways that COVID-19 continues to affect communities. It's another example of why we must do all that we can to stop its spread.
Okay, thank you, Dr. Westergaard. And we'll now open it up for questions. A reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. And we have time today for 1 question and a follow-up. And we'll begin today with Matt Piper from the Sheboygan Press. Matt?
Hi, yeah, thank you. Stephanie, would you go into a little more detail about the contact tracing takeaways that you got from the 20 to 29-year-olds? I'm sorry, I was frantically trying to type there, and I just don't think I quite caught it. 30% during June did what exactly?
Sure. So 30% in June had among those 20 to 29-year-olds attended a gathering party or met up with people outside of their household. So of all of the people that we've interviewed, those were activities that those folks reported engaging in.
Do you have a follow-up, Matt?
Yeah. Sorry about that. Yeah, so these were people who were tested positive for the virus, or people who had exposure to people who tested positive? I'm sorry, I'm never quite clear with the contact tracing contacts you were talking about.
No, that's a great question, actually. Good clarification there, because we do a couple of different activities. So one is sort of the disease investigation interview, and that is the thing that helps us to learn about, how people may have been exposed to this virus, once they test positive. And then from there, we also do the contact tracing, so we ask the person, who they may have been in contact with, and they're reporting, when they tell us about their contacts, that they've, that these engagements have been, either a party or meeting up with people outside of their household, which is different than the trends that we were seeing in May and April.
Thank you, Matt.
Great, thank you.
Now to Marty Glazer from Spectrum News 1. Marty? Marty Glazer from Spectrum News. And a reminder, *6 to unmute your phones. Marty? Marty, we're going to move on, but we'll come back to you later, okay? We'll move on now to Denise Lockwood from Racine County I. Denise? Denise Lockwood.
Sorry. I had a question with regards to that there have been a number of reports nationally around the efficacy of tests and the handling of test samples. And is there any risk of that happening here? And if so, what kind of quality control is in place to hold labs accountable?
Yeah, that's a great question. I would probably defer to Dr. Westergaard as the healthcare provider to answer that one.
Sure. The things that can make that can decrease the sensitivity of the effectiveness of tests are involving the ways in which it's collected and the way in which it's transported primarily. On the specimen collection side, we ensure that all the clinical sites and the community sites that are involved in testing people involve staff that have been trained in a standardized way, meaning they know how to use the swabs and the transport medium, the tubes. On the transportation side, there is a need to get the specimens transported to the labs quickly, because if they go at room temperature for too long, for more than 24 hours in some cases and 72 hours total in some other cases, depending on the lab specimen, the results are no longer valid. So there is an important supply chain and sort of chain of custody, if you will, about the specimens. On the quality control side, we're making sure that all our healthcare partners know the procedures and the standard operating procedures, and we do continual training and oversight of our National Guard volunteers to do this. Those are the main precautions.
And do you have a follow-up, Denise? Okay, we'll move on.
I did have a follow-up. But as far as, I'm sorry?
Go ahead.
Okay. As far as checking that process, once those tests have been collected, what's the insurance around making sure that those actually collected correctly and making sure that they're done right?
Were you able to hear that, Ryan?
I'm not able, sorry, I understand the question. Is it the mechanism for making sure that things are done correctly?
The assurance is yes.
Well, I think it's similar to all aspects of how we do laboratory medicine collection in healthcare. It involves training. It involves a structure where there are supervisors and oversight. So I think we largely rely on our existing healthcare system to make sure that we have trained staff in the field to do that and that they're appropriately supervised.
Thank you, Denise. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thank you for holding this. I've seen reports in other states that there have been an increase in opioid-related overdoses during the pandemic. Was wondering if you were seeing the same thing in Wisconsin, to what degree, and if the pandemic is exacerbating the opioid crisis at all. Thank you.
Yeah, it's Ryan Westergaard. I can speak to that and be happy to get back to you after consulting with some of our data specialists for precise numbers. But my understanding, speaking with those at DHS who work in the opioid response, is that, like many states, fatal overdoses have increased in Wisconsin in the first half months of 2020 compared to 2019. The reasons for this are unclear. A lot of services are difficult to access because of the ways in which healthcare and other services have been changed. There's a lot of, I think, need to understand this better. But we have not been spared for that, and I think it's a good reminder that the opioid crisis and other longstanding health conditions of importance to public health have not gone away, and in some cases are worse.
Yeah, follow-up, Sean.
I should be good, thank you.
Okay, thank you. Now to Eric Gunn from Wisconsin Examiner. Eric?
The numbers are looking really quite striking and sobering across the state. Are you seeing anything that you would say would be good news and that would be things that we can learn from, or that would be examples to follow, or just signs of any improvement?
How about I start with this, and Ryan, you can follow up. But I would say that yes, we are seeing, even though we have lots of things to sort of report on that may not be so good in terms of the the numbers. Wisconsin is considered to be have a very high COVID-19 activity level statewide, and that sort of the sort of trend, if you will, is increasing overall. And we would say that all 7 of our Wisconsin regions that we monitor are considered to have high disease activity levels. And there's only 2 counties reporting this week with a low COVID-19 activity level. So, we've got, there's some challenges there with the spread in our state. What I will say is that, I'm really encouraged. There's some, great things that are happening in terms of, sort of the partnerships that have been established throughout this response. Folks coming together, public health, healthcare workers, trying to really do everything that they can and that we can collectively to help, get resources to people, who need them, and to make sure that people, our most vulnerable populations are protected. I would say that, from the, the data perspective, we are still, our our death overall, sort of rate has been, decreasing. We're not seeing quite the same level of deaths reported to us, that is obviously a very good thing. And certainly there are many people that we're listing on our website, who have recovered, from this disease. But keeping in mind that recovered does not necessarily mean without long-term effects from this disease. So, we're going to keep plugging away, and we really are hoping, that we have to, sort of do this together, and everybody, we need everyone's help in order to stop the spread of this disease. Dr. Westergaard, is there anything you'd want to add?
I guess I would add, when looking at the epidemic indicators, the data around cases, the news is mostly bad. We are in a bad position. The trend is going in the wrong direction. One thing that I particularly found concerning is the number, although our cases have increased among the younger population, although we have incomplete data on all the clinical information, it seems like a majority of individuals in the younger age group are being tested because they're symptomatic. We know that people who are particularly 20 and younger have a large degree of people who have minimal or no symptoms. So that might give us reason to worry that we're actually not testing enough people, or testing a tip of the iceberg. So on the side of the epidemic, dynamics transmission, I think the news is sort of bad and potentially getting worse. The things that give us hope that I'd also highlight, and again, we don't have as much data on this, but I think I can just reflect some of our experience and observations. Exactly like Stephanie said, the partnerships between local public health and healthcare has been really encouraging. There's a sense that we're all in this together, and as things evolve, we need to rely on each other and keep communications open. The other thing that I've noticed this week in conversations with people from media and other community groups is that I believe we're making progress on on establishing wider social norms around mask use. There certainly is in the media certain hesitancy around wearing masks, and I've had conversations increasingly in this past week. My sense is that most people get it, that we're moving toward feeling that it's more normal to be wearing masks in public. I think we're acknowledging that the science is becoming clearer all the time, that in this really challenging situation, the best news, I think personally, of the past week is that the science continues to get stronger, that we have a very inexpensive and easy tool to reduce transmission, which is wearing masks in public. So that to me is the bright spot, that number one, the science is getting stronger, and number two, that the people starting to be embracing the science and behaviors are changing on a larger scale.
Eric, did you have a follow-up?
No, that's good. Thanks.
Okay, thank you. Now to David Wahlberg from the Wisconsin State Journal. David?
Hi, thank you. Dr. Westergaard, the F-16s were flying over my house when you were talking about MISC. So I'm wondering if you said how many cases we've seen in Wisconsin, and if you could please repeat that.
Sure.
And then my other question is, generally, I know both of you have said we have high activity in most of the state and among young adults. Are there any particular counties you're watching really closely or most concerned about?
Sure, I can repeat the numbers about the MISC. We've had 6 confirmed cases. So earlier we reported there were a larger number of suspected cases. The process then became working with the local providers and with CDC to confirm whether they meet the official case definition, and 6 have. So 6 have been confirmed.
And you had another question, David, about activity among young people in a county that we're watching closely for that?
Are there particular counties that are that we're particularly concerned about?
Yes.
Yeah, and I can take a stab at that. It'll just take me a second. I'm unburying some of my data, so I apologize for that. So I would say that definitely we know that areas we continue to see high numbers of cases in Milwaukee. That that trajectory, so sort of has been increasing over the last couple of weeks or so, more so than it has been. And certainly, we had wanted to keep an eye on Dane County, of course, keeping an eye there, but it looks like some of their activity might be maybe not decreasing. I wouldn't necessarily say that, but they are not reporting the same high levels of cases, at least in the past couple of days. So so those are areas that we'll continue to watch. So I think that I'll pause there.
Thank you. Moving on then to Ricardo Torres from Milwaukee Journal-Sentinel. Ricardo.
Thank you. My question is on contact tracing in regards to schools and businesses. If a child in a classroom tests positive, is the whole classroom then tested, the whole school, or same type of situation with businesses? So I'd like some elaboration on that.
So I can take that one from our sort of procedural aspect. So the role of testing as part of contact tracing is reserved for people who have been identified as close contact and then at high risk of people through that process. So the way we define close contact in these case investigations is being within 6 feet of a person with COVID-19 for at least 15 minutes. And the 15 minutes don't need to be consecutive. So being in the same workplace or the same classroom as someone who has been confirmed to be a positive case isn't by itself enough to make one in that exposed category or close contact. So that really speaks to the importance of those case investigations. We don't want to have higher. We want to use resources appropriately. So the big challenge and the big need for the public health response is to really evaluate people who have been at risk. And then the role of testing is for people who are symptomatic, of course, and then people who have been in close contact through that, as defined, as I mentioned, through that investigation.
Did you have another question, Ricardo?
Yeah, just so I'm clear, the contact tracing is more, to go back to the classroom example, not everyone in the classroom will get tested then in that case, correct?
That'd be correct. Only if they were identified as a close contact.
Thank you, Ricardo. Now to Todd Richmond from the Associated Press. Todd? And a reminder, *6 to unmute your phone. Todd Richmond from the Associated Press. Okay, we're going to move on. We'll try to get back to Todd later. To Emily Davies now from WSAW-TV in Wausau. Emily?
Thanks for taking the call. I have a question about the COVID-19 deaths. So we've had a lot of people reach out to us with questions about how those are counted. People have been concerned about, say, somebody has a heart attack, they also test positive for COVID. Is that death a result of the heart attack, or is that a death as a result of COVID? I'm sure there are other, it could maybe potentially speed it up, or say they have cancer and they also test positive for COVID. So just can you clarify how deaths are recorded related to COVID?
Sure, it's a good question, and in the sense that people can die with a COVID-19 infection and not necessarily from COVID-19 infection. That's a common scenario. All people who pass away in hospitals. People have multiple conditions, and it's not necessarily any given one of them that directly caused the death. So that's why we have medical examiners and standard processes for after people pass away, particularly in hospitals, to really try to do a post-mortem examination, which sometimes involves an autopsy, but most commonly does not, to really try to understand what is the cause of death. So that having those processes in place and using those for COVID-19 deaths is the way that we identify deaths due to COVID-19. It's also the explanation for why there can be a bit of a lag. So that's COVID-19 aren't reported immediately the next day, because there's some evaluation that goes on to determine exactly the question you asked.
Did you have a follow-up, Emily?
I did, thank you. So I guess related to that, is there a standardized process to looking at what the cause might ultimately be for all counties, for all medical examiners, and just making sure that that is followed?
There's a standard process for filling out death certificates, and if an examination by a medical examiner is conducted, they go through standard training and have protocols. In cases that don't go to a medical examiner, the treating physician can be asked to attest for what was the cause of death. So there is some heterogeneity in how the process works.
Thank you, Emily. Now to Jonathan Nizer from NBC 26. Jonathan?
Yes, thanks for the call. Just were wondering if there is a school that holds some in-person classes and a spike happens, what can the state do to address that situation or help in that situation?
Well, as I mentioned, with any case gets investigated by local public health to identify the places and people that may have been exposed to that person. So, in the setting of a school, the responsibility and really the lead of those investigations are the local health department, either at the county or the municipal level or the tribal health department. Through the response so far, and particularly into the fall, there needs to be, and there has been, close collaboration with school districts and local public health, and us at the state, who serve a coordinating role. So in general, the way that we will support at the state are to make sure people have available to the best data, that we can facilitate communication between school districts, either principals or superintendents, and local public health. So when they do those investigations, they can understand, is it an isolated case? Were there people who were exposed who potentially need to be quarantined or tested? So it's the location of all those decisions are really at the local level, and that the state plays a supporting it and coordinating role.
And that's not sort of distinct to COVID-19 either. That is something that we do for other types of communicable disease outbreaks. We work really closely, with the local health department and there's school health officials, school administrators to provide whatever expertise and recommendations that they, need for us to weigh in on.
And Jonathan, do you have a follow-up?
No, thank you.
Thank you. Now to Stephanie Hoff from West Politics. Stephanie?
Hi, thank you for taking this call. My question is for both Administrator Smiley and Dr. Westergaard. Some COVID-19 hospital data has been removed from the CDC's website, and this follows the Trump administration's decision to reroute coronavirus information. What are your responses to that?
I'll take a crack at that. So what is great about Wisconsin and sort of the partnerships, again, kind of getting back to that conversation that we had earlier in the briefing, is that we worked really closely with our hospital partners to establish a way to collect this information through sort of a survey, if you will, or a standard reporting mechanism. And so, and then we were reporting that information on behalf of hospitals to the federal government. And that process will not change. So for us in Wisconsin, all that information does come to the state, and we at the state then provide that information to wherever it needs to go. It was there early on in the response, there were many places that data needed to be reported. And so as part of a way to help streamline and not put the burden on our healthcare partners who are really busily preparing, their own response activities, we wanted to make sure that we had a mechanism in place to, where they submit it once, and then we can, help provide that data to whoever is requesting it at the federal level.
And a follow-up, Stephanie?
Yeah, am I mute? Can you hear me?
Yes, we can.
Okay, so yeah, my question is, where do you think that information should be posted for the public to see?
So at the Department of Health Services, we actually do post, much of the information that we collect on our website under the Hospital Capabilities tab. We believe that is part of what the information that folks need to understand is sort of where are we in terms of maxing out hospital capacity, and that's something that we've done here in the state, and we will continue to do so.
Thank you, Stephanie. Now to Ben Krumholtz from WLUK-TV in Green Bay. Ben?
Hi, thank you for the opportunity. Do you know what percentage of COVID deaths, people who've died from COVID, had no previous health issues?
Unfortunately, I don't think we don't have a good estimate of that handy. There's comorbidity data that's sort of collected in the background. So I don't have a number, but Stephanie, do you have a better estimate?
I don't, and I know that folks are working on that. It has been a topic of a lot of conversation here at the department, and I know nationwide. And so I know that there are folks that are working on that information, but I don't have anything off the top of my head or in front of me. But as soon as we're able to share that, we absolutely will.
And do you have a follow-up, Ben?
Do you have a ballpark at least? I know earlier you said it's pretty common for someone who dies from COVID to have health-related issues.
I think we would have to follow up offline.
We'll do so. Thank you, Ben. Now to Danny Maxwell from WKOW-TV in Madison. Danny?
Hi there. My question is, I noticed DHS is now recommending staff at nursing homes to be tested every 2 weeks. But why not have the same recommendation for assisted living facilities, long-term care facilities, who also care for some of the most vulnerable populations, and those staff members also come and go? Hello?
Hi, Emily.
Sure. So, Ryan Westergaard, I can address that. So it is the recommendations have been developed that we've posted and convened a committee of stakeholders around specifically for nursing homes because there's some uniformity that they're all sort of regulated through the same entities and have some similarities. The recommendations were directed to that group, but I wouldn't say that they're necessarily exclusive. I think there's certainly reasons to be proactive and test staff and other in other settings as well. But the task of making guidance documents sometimes requires having a sort of a narrow audience focused directly. So your point that individuals who are exposed to vulnerable populations should be aggressively screened for symptoms and tested when resources apply is a valid one, and I don't disagree with that.
And Emily, do you have a follow-up?
No, that is all. Thank you so much.
Thank you. Now to Michelle Beck from WMTV NBC 15 in Madison. Michelle? NBC 15? Okay, we're going to go back to some callers that we missed earlier. Marty Glazer from Spectrum News 1. Marty?
Can you hear me? Can you hear me?
Yes, is this Marty?
Yes, this is her. I'm so sorry about that. I know that you've already touched on this, Dr. Westergaard, when we talked about the positive cases that we're sending in the last 5 weeks and some of those challenges. But can you explain what we can do again to make it better? And by mandating masks, is that supposed to help bring the levels down?
It sounded like there were two parts to your question. I'm afraid I didn't catch them. Could you repeat it?
Yeah, if you could just reiterate with the positive cases that have been ascending in the state. Some would say that it's because people have become so complacent. What would you say we can do to make things better? Are we hoping that by putting in these mandates for the masks, that's going to bring the rates down?
Yes, I think there's good reason to believe that widespread adoption of masks in public places, not as a sole strategy or the only strategy, but as an important strategy in combination of limiting the size of gatherings and physical distancing in all the areas where people tend to mix in public, could have an enormous difference. I think if we could get to 90% or above masks in public locations, particularly in social gatherings where people tend to be in close contact, I think that could very conceivably make our numbers go down in over the short term. So I think it's one of the most important strategies that we have right now. The other thing that I think we probably need to talk about more, in addition to that, public mask wearing is sort of a whole statewide strategy, but I think we also need to talk more about the specific instances when we do respond to cases and local public health is contacting people who have been exposed, being really serious about supporting individuals who need to quarantine and to find safe places for people to isolate while they're symptomatic. That is the other thing that we can always do better. There's a lot of variability on the ability and the safety and the resources that people have to do isolation and quarantine. And we as a state and communities, the more that we can do to take that tool very seriously as really one of the most important ways to break the chains of transmission is when someone is exposed or someone is positive, to really do isolation and quarantine well so they're not in contact with other people during the at-risk period. That's the other area where I think we can build better systems and better supports in place. So between those two things, the very focused, aggressive isolation and quarantine and all the social supports that must go along with that, and the widespread wearing of masks, I think we could get this back under control. I think it's not a foregone conclusion that this is going to get away from us. I think if we did those things very well, we could flatten the curve again. And I really am optimistic that we can make progress on those things, particularly now in the summer before other respiratory viruses start to tick up in the fall.
Thank you so much.
Thank you, Marty. And we'll try one more time for Todd Richmond from the Associated Press. Todd, are you available? If not, he did email a question, which is asking Stephanie Smiley to clarify the 20 to 29-year-old cases and how what we're seeing now differs from what we saw earlier in April and May.
Sure. So I guess it really comes down to the activities that people are engaging in that particular age group. So, so for example, in April, we were not seeing that many cases in that age group that had reported engaging in activities like meeting up with friends and having gatherings and things like that. You sort of fast forward to May, and we saw about 12% of people in that age range reporting gathering and meeting up with people outside of their household. In June, that number rose to 30% of people we talked with in that age range who had reported gathering with people outside of their immediate household, and that has increased over the last several months, and so we are anxiously waiting for the data to see what July is going to look like, but it is not a trend that is a positive one. We still want people to limit their contacts, and wearing that sort of that barrier, that face covering when you are in proximity with other people outside of your household, and still maintaining that physical distance is really going to be the safest thing that you're going to be able to do to protect yourself and other people that you may be seeing. It is difficult to do that, and to do this, and engage in sort of this physical distancing for extended periods of time. It is hard, but we need to sort of all do our part again in order to stop the spread of this disease in our state.
Thank you, Stephanie. And that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management.